So today we're going to study about the cardiac cycle, and it's important for us to study cardiac cycle because it consists of precisely like timed electrical and mechanical event which are responsible for your rhythmic atrial contractions and also your ventricular contraction, right? And often we use words like systole and diastole. Systole basically means contractions, and diastole basically means relaxations. Okay, so I've already drawn some of the pictures, and as we go, we're gonna discuss very detailed about what is happening in each phase. Okay, so let's start with this. This is a heart that I drew here, and what is happening here is that if I could draw this heart, I kind of broke it down. Let's define this as right side of the heart, and this is the left side of the heart. Okay, and this is going to be my right atrium, and then right atrium. This is going to be my right ventricle, and this is going to be my left ventricle, and this is going to be my left atrium, right? And obviously this is interventricular septum. These are different valve or cusp, and then this is going to be my pulmonary trunk or pulmonary artery, and this is going to be my aorta right here. And I kind of like also attach this thing, which is a ligament. This is a ductus of arteriosus. So what is happening is that we have a double circulations in a human being, right? So what is happening is all the deoxygenated blood from your upper neck area to head and neck area is getting by this vein, which is called superior vena cava, right? Superior vena cava is getting blood from your head and your neck areas, and then from all the lower part of your body, is getting from this guy, which is going to be my inferior vena cava systems, and that is draining all the deoxygenated blood into your right atrium, right? And then, as we know, what happens is that all these superior vena cava, inferior vena cava, they're bringing the deoxygenated blood that is draining in the posterior of your atrium, posterior right atrium, which is the smooth part. That's what it is draining, because your aorta, because your right atrium does have the ridges, which are called rough part, and those ridges are called the muscularis papillaris, or papillary muscles are attached there. And not only that, there are a couple of things we also have to understand is, okay, we understood the blood that is coming from head and neck is getting by superior vena cava, which is draining the right atrium. From the lower part of your body, from your GI, from your legs and all, they're coming to the inferior vena cava and they're into right atrium. But we also have to understand what about the deoxygenated blood that is coming from your heart itself, and that is coming from your coronary sinus, right? So basically, let's quickly talk about that. Actually, let me erase this and then let me explain this to you, how your heart is draining the blood into your right atrium. So if I quickly talk about my heart, let's just say this is my right atrium, and then let's say this is my left ventricle, and then there's going to be there's going to be interventricular septum. So what happens is that, and obviously these atrias, the atrias are separated by something called interatrial group that separates your atria, and then what separates your two ventricles this is called coronary sulcus, not sinus. Okay, coronary sulcus is S-U-L-K. Sulcus is one that is demarcating your atrium with the ventricles, right? And really what happens is that if I draw this atrium, the right atrium is in a little bigger. So what is happening here is that I'm just drawing for the understanding purpose. Obviously this is where, obviously in here you have S and O, right? And what is there is, this is coming from this, what's the inferior vena cava, and what you have is there is this fibrous skeleton coming down here, something like this, and then from the lower margins and becoming your fibrous skeleton, right? And then when you see this, there's going to be sort of like an angle, which is called Cox triangle, and you have this little bit of bulge down around right here, which is called my coronary sinus. And this coronary sinus is important because this is draining blood into your right atrium, right? But deoxygenated blood in right atrium. So what is happening here is, if I could draw, let me use a blue. Actually, let me use blue for this one. So what is happening here is that there is a vein coming from here, which is called this is going to be interventricular, okay, interventricular vein, which is coming from down lower margins of here, and then it comes and kind of loops and goes to this way, which is the left side of the heart. And then what is that? Let me actually draw this with the black color and make this coronary sulcus, so we don't get confused with the coronary sinus. So, and it loops around from your left side of the heart with left atrium, and it comes here and drains into the coronary sinus. This is called my interventricular vein, which is looping around and becomes your great cardiac veins, and that is draining into your coronary sinus. Okay, and then also what is happening is there's one vein coming with usually with the left marginal vein, which also drains into your, what is this, on your great cardiac vein. So this is going to be left marginal vein, left marginals, which is into great cardiac veins, and great cardiac vein drain into your coronary sinus. There's also, I'm going to use this dotted line as your posterior side. There's something called posterior interventricular veins from the left side of the, let's say posterior left ventricular vein. Left ventricular vein also goes and drains into your coronary sinus. Okay, now there is one more vein that's a very important vein. This is called medial cardiac vein. Okay, so medial cardiac vein, which runs with your PDA, okay, which is a posterior descending artery, and that one's, what it does is it runs with it, and this also goes and drains into your coronary sinuses. There are also some veins coming from down here, which is going to be right marginal vein, that also goes and kind of loops around, become your small vein, your small cardiac veins, and goes and drains into your coronary sinus. And there's one more vein that is coming from here, from your left side of your left atrium, which is going to be your something called left oblique vein, that also drains into your coronary sinus. And this is very, very important concept, guys. You have to know this. At least know the great cardiac veins, middle cardiac veins, interventricular vein, left marginal veins. At least these guys are draining into coronary sinus, because there's one more vessels, which I'm going to use this in color green. This is called anterior cardiac veins, which usually comes and there are small vessels, which does not drain into coronary sinus. These are anterior cardiac vein, which does not drain into your coronary sinus. They directly drain into your right atrium. These are anterior cardiac veins. Okay, so again, I'm going to repeat one more time. This anterior cardiac vein does not drain into coronary sinus. It drains directly into right atrium, just like superior vena cava, inferior vena cava. Okay, and the one more vessels that I'm going to talk about, the vein that is called, it's called venae. It's called VENA, venae. Okay, codex minimae, or they also call smallest cardiac vein. Okay, cardiac vein. They are also known for THEASB, Thevesian vein, or veins of WEAR. These are the names given. So there's a venae, codex minimae, or smallest cardiac veins, or Thesivian vein, or vein of Warren. They all mean the same thing. These ones are the smallest cardiac veins, which one of the main functions of it drains into all four chambers of the heart. Okay, and one of the most important things about your Thesivian veins you should remember is that because of the Thesivian vein, these guys are draining into all the four chambers of the heart, which means they're also draining into left atrium and left ventricle. Because of this, they're draining into left atrium and left ventricle. What happens is that whatever oxygenated blood is coming from, the 100% oxygenated blood is coming from, these guys play a role in desaturating that blood, Thesivian vein in your left atrium and left ventricle, because they drain all chambers of the heart. Okay. I was just trying to show you that what are the role of how the blood or deoxygen blood is coming and draining into the right atrium, just for your understanding purpose. Okay. Now let's me erase this thing and let's quickly talk about these things. So usually what happens is that one of the important concepts you have to understand is that really what happens is that you have blood here, right? You have a blood accumulated here, right? So what happens is that there's already in here in the ventricles, when we use the colors of like blue here, so what happens is that there's already some volumes of the blood is accumulated here, and this volume is accumulated on your right ventricle, so as your left ventricle, and this volume that accumulated here, we call them as end systolic volume. Okay, the end systolic volume, and then which is about like 60 or let's say 60 to like 70 ml of the blood, and then there's other volume of the blood is accumulated about like 45 ml of the blood. Okay, so basically if I do this, it's going to be from the rapid passive ventricular filling, and then a slow passive ventricular filling. Okay, and they have accumulated about like 45 ml of the blood, or 50 ml of the blood they're accumulated, right? And you guys will know as we discuss more about it, you guys will know what exactly this means. Okay, and same thing here also, same thing is also happening in here, right? So basically what I'm trying to say is that both the left and right side of the heart, okay, they already have about like 70 to 80% of blood that is filled by the ventricle. Okay, that's already there. Okay, before even the atrial depolarizations happens, before even the atrial systole happens, before even the atrial contraction happens, there's already about like 80% of 70-80% of blood has been filled. So only about like 20% of blood that's going to push from the atrium to the ventricles. Okay, same from left atrium to your left ventricle. Because every time when we talk about, okay, what is happening, every time when you talk about the heart itself, we have to talk about a couple of things. We have to talk about what is happening to the atria, what is happening to the ventricle, what is happening to the, let's say, pulmonary artery, if we're talking the right side of the heart. From the left side of the heart, we also talk about what is happening to the left atrium, what is happening to the left ventricle, what is happening to the aorta. We have to talk about all the things, and we have to compare the pressure and the volume. We have to understand the pressure and volume relationship in each phase. All right, and we also have to talk about the heart sound as well. So what happens is that when SNO cells, which is down here, when they fire electrical impulses, because they have intrinsic property of firing, right? That's what they are called, automaticity. They are also called pacemaker of the cell, right? So whenever they fire, what happens? Whenever they send electrical impulses, the atria is going to go contraction, right? Atria is going to go depolarize. So when the atria contracts, what happens? When the atria contracts, whatever blood it has, so let's say blood in red actually. So this whatever is accumulated, right? Whatever 20% of the blood, around like 15-20%, it's accumulated. What happens is that that's going to contract. Okay, that's going to come into the ventricle. So what happens is that at the time, this one is, I'm referring as this a cusp. These are your, what are these? These are cusp, right? And this cusp are obviously made out of you. This cusp, you have three cusps. These are called tricuspid. They cause tricuspid valve. Okay, and these ones are made out of your endocardial tissues. Okay, endocardium with the connective tissues. And then on your left side, these are called bicusp because there are only two cusps. Okay, bicusp, or they're also simply called mitral valve. Okay, they're known as your AV valves, and this one is your pulmonary, and this is your aortic valve. So these are also known as semilunar valves, right? And what happens inside the ventricle, what it is that this cusp are attached with muscles which are called papillary muscles, right? Like which are called papillary muscles, like this, and then like this, about like two papillary muscles. So obviously these are attached with the papillary muscles. Okay. These are attached to the papillary, and these guys, like the thread-like structure, these are called chorda tendineae. All right. So when the atria contracts, what happens is that obviously, if you're talking on the right side of the heart, your valve, which is your tricuspid valve, is opened. Right. So blood will come So blood will come here like this, and then from here, when the atrial contract left heart, it will come because mitral valve is open at the time, right? And opening of the valve does not produce any sounds, guys. So when the atria contracts, whatever the blood it has, it will move to the ventricles, right? Now, this first phase of our contraction, we call them as your atrial systole, or you can simply say atrial contraction. That's the first phase of your cardiac cycle, right? Now, in the both case, we have now both mitral valve and our tricuspid valve and mitral valve, they're open and they push all those 20% of the blood. Now you have 100% of blood. That time, what is happening on the ventricle? Ventricle is working as a relaxed chamber. They're just working as a relaxed chamber. You know, they're just relaxing, so they're just receiving the blood. And what is happening to the pulmonary artery? The pulmonary valve was closed that time. Pulmonary valve was closed that time. Same with here. If you talk left heart, what is happening to the ventricle? They are working as relaxed chambers, and then your aortic valve is what? Closed that time, right? That's what is happening here. Now, in the atrial systole. Now let's move to next phase. What is happening in the next phase? And guys, remember, when the atrial contract, what happens is that it kind of like, when the atrial contracts, with the contractions of certain kind of wave it get produced. So they call this as this wave. Okay, this is a mechanical wave. This is called A wave. It represents atrial contraction. Do not get confused with your P wave, because P wave is representing your electrical event. This is representing your mechanical event. All right. Now, again, so now the blood here is okay. All the body here is, we have three different stuff. You have something, we say this was there's a rapid passive ventricle filling, there's a slow passive ventricle filling, and also end-systolic volume, and also atrial contraction. So basically you have all the blood in here. When that happens, what happens is that before that your ventricle was relaxed chamber. So whenever the blood came in here, if the pressure was 0 there, then it probably went up to a little bit, up to like, let's say 5 to 8. We can say just, let's say 8 millimeters of mercury. Okay, here generally usually what happens is that if you talk about atria, the atria and the pressure is usually about like right, if you talk about your right side of the heart, it's about usually from 0 to like 5 millimeters of mercury, if you want to know that. And then if you're talking the left side of the heart, left side of the atrium is about like 5 to 10 millimeters of mercury. Okay, so that's what is happening just for the pressure systems. Now, so really what happens is that now the blood is here, right? So usually remember what happens is that when the SI node fires, electrodepolarization happens, right? And what happens is that when the atria is contracting, the ventricle are relaxing as a chamber. They're not contracting at the time because they're also waiting for the impulses to get from the AV node, because usually there is a delay of 0.09 seconds, and altogether there's a delay of 0.16 seconds. So there is an impulse that is slowly coming from the ventricle before the ventricle start contracting. And because of the blood, maybe because of the blood, what happens is that because atrial contraction, and then it pushes the ventricle wall, so maybe it generates a little bit of pressure, maybe up to 8 millimeters of mercury or something, and which usually is, for this condition, let's say this is for your right ventricle, let's say about 6 millimeters of mercury, because usually pressure here is from the 0 to 5 millimeters of mercury, and here it's about 5 to 10 millimeters of mercury, I said, right? And here maybe it went up a little bit of like, let's say 11 millimeters of mercury. Okay, 11 millimeters of mercury, that's what it is. So as soon as when it gets impulses and then the pressure goes more than your intraventricular pressure is more than your intraatrial pressure, the ventricle will start contracting, right? Same thing here. As soon as when the pressures in the intraventricular pressure is higher than your right intraventricular pressure is higher than your right intraatrial pressure, the ventricle will start contracting now. When the ventricle starts contracting, what happens is that blood will try to go back. So what happens is that because these are connecting with like these are chordae tendineae, right? These are connected with these papillary muscles. Same thing with here. Same thing with here too. Okay. This is right. So what is happening here is that now this will start contracting, right? So start contracting. Because remember, what is receiving your blood is if you talk about the ventricles, your rough part is receiving your inflow is your rough part, which is a trabeculae carneae, which we call it trabeculae coronae. This is a rough part of your ventricles, right? Because these are called ridges. They have all these ridges and all that stuff. Now, this is the inflow part. The blood receives by that. Okay, the rough ridges part receives that. But when the outflow systems, it's called the smooth part, and especially for the right ventricle, we call them. You have to remember this, guys. We call them this one. Smooth part is called subpulmonary infundibulum. Okay, infundibulum, or simply say, you can say conus arteriosus. It's got conus arteriosus because the blood is going to go from this way. Okay, but we'll talk about this. But I'm just saying that I'm just dividing. A rough part always receives the inflow part when it comes to the ventricles, and the smooth part is where the blood ejections will happen. And specifically for the right ventricle, we call them as subpulmonary infundibulum. For the smooth part for your left ventricle, this one, okay, this one, we call them as aortic vestibule, okay, because this is the outflow part. This is the outflow part, right? Because the rough part is still the trabecular cornea here. So now, when the blood, now let's say this is your ventricles start contracting, right? So when the ventricles start contracting, what happens is the blood try to go back into your left atrium for this one, and then for here the blood is trying to go back to your back right here on the tricuspid, on the right atrium to the tricuspid valve, because this time the ventricle is not closed yet. So when the blood try to go back, what happens is that if this is my valve, this is a leaflet, right? When the blood try to go back, it will kind of open like this, right? It will open like this, and then what happens is that this chord tendon pulls it. When the chord tendon pulls it, what happens? It causes vibrations. It causes a vibration, right? When it causes a vibration, because of that, what happens is that because that causes vibrations, and it pulls it, and it closes the mitral valve, and same here, it closes tricuspid valve if you're talking about the right side of the heart. So it closes mitral valve for the left side of the heart, and it closes tricuspid valve for your right side of the heart. Okay, so because of this, so in left side mitral valve is closed, and then right side your tricuspid valve. When that happens, what happens is that there's a first heart sounds are produced. Okay, that first heart sound we call them S1 sound. Okay, this is called S1 sound. This is called S1 sound. Okay, and then we say that's love, L-U-B, love, not the love that we often love our family and parents, but it's a different type of love that get produced. And also, I often think, love is not a feeling. Love is a verb. I don't think so now. But anyways, so coming back here, so it will produce a sound, and because it will produce a sound, we call them as S1 sound, and it will sound like love, love. That's what it is, right? And now when the mitral valve is closed and the tricuspid valve is closed, what is happening to the ventricles? The ventricles started contracting. They'll continue contracting. But remember, what is happening here? But in this case, you have aortic, and let me use the green and say this is permanently closed with this. Let me make this as permanently closed right here. Okay, so when this represents permanently closed. So now they're closed, and look, if you look at this, the pulmonary valve is already closed here, okay, and then your aortic valve is also closed here, okay. So your ventricle is working as a single chamber. Okay, right ventricle, left ventricle, okay? They're working as a single chamber, and the volume is not changing because whatever the volume is received, it's going to contract on that, okay? Because of this, we call them as this phase is called isovolumetric contractions. Okay, we call them as isovolumetric contractions. I'm going to reference that. Isovolumetric systole, let's say. Okay? And remember, when it try to go back, it pulls the cord tendon, right? It kind of makes like little jerks. So because of that, if you look at this one, it will produce kind of like this way. So that would represent as your C wave. Okay? Now this ventricles contracts, and maybe let's go up to 80. Okay? Again, now this is for the 80, and from here, what is happening here is that now keep going. Okay? And then this also keep going, keep contracting, and as soon as it reaches about 81 millimeters of mercury, okay, what happens is that your aortic valve opens up, okay, and then even same thing, you keep going, and usually about what happens is that ventricles about like let's say 11 millimeters of mercury, what happens is that the right ventricle opens up, okay? So, sorry, not right ventricle opens up, your pulmonary valve opens up, okay? This pulmonary valve opens up. Here it's 81 millimeters of mercury, here's like about 11 millimeters of mercury, but let's focus more on the left side of the heart because that is more important, all right? So about 81 millimeters of mercury, what happens is that your aortic valve opens up. So let me open this up, and then let me say that this is open now. So aortic valve opens, so all the blood started going this way, okay, to the aorta. Same thing here. All this blood in the right ventricle started going out to the pulmonary trunk from the right ventricle, and this is going to the aorta. And what is happening into the atrium at the same time? These atriums are receiving the venous blood. Your left ventricle is going to, because your mitral valve is closed, right? So what happens is that it will start receiving blood from the, let's say, the lungs, okay, from the venous blood, okay, the venous blood, whatever, from the lungs, start receiving the blood from your lungs. That's what these guys are doing. These guys, that's what is gonna happen that time. Same thing we hear too. Here the blood is from the right atrium, all the from superior vena cava, inferior vena cava, they are going to receive started getting the blood from the other lower part of the body, upper part of the body. That's what is going to happen here. So they're receiving deoxygenated blood here, but these guys are receiving oxygenated blood here on the left atrium, okay? That's what is happening. In this phase, when the pressure went up to like about 81, the aortic valve opens up, right? So the pressure, that when it opens up, what happens is that this ventricle, or your left ventricle, ejects the blood, okay, by each ventricle. So ejections of blood by each ventricle per beat, that is called your stroke volume, okay? So they're ejecting the blood, and this is ejecting. This phase is called, we call this phase as called rapid ejection phase, okay? That's what is happening, right? That's right. And then when it's happening, what happens is pressure is keep going, and it may go up to like about 120 millimeters of mercury. So that's what is happening right here, right? That's what is going to happen in this phase. And that time, again, these guys will keep going, and it may go up to like 25 millimeters of mercury, okay? That's the highest it'll go, and it'll go from the pulmonary artery. And these guys are just, and this is closed right now, okay? They're just working as your right atrium, just working as a, let's say, receiving, because this is diastole is happening. Because remember, in this phase, what is happening here? This phase, what is happening? Atria is working in the isovolumetric contraction. Atria is working as a diastole. Atria is relaxing here. Okay, and that's why they start receiving the venous blood, okay, both the side. And then even in the same thing here, atria is working as a relaxation, so atrial diastole is happening, but the ventricle systole is happening here, right? Now, that is what is happening here. Now, so if we talk about this one, it went to 0, then 80, then it went to 120, right? Then what happens is that a lot of blood has, what is happening is that now the aorta, because remember, right now, if the pressure is on the ventricle is 80, then what is happening to the pressure in the ventricle? If let's say this open at 81, right? So if let's say the ventricle pressure is 81, that means the aortic pressure is going to be 81 too. If the ventricle pressure is going to be 120 up to 120 here, the aortic pressure is going to be also 120, because remember, aorta is elastic. The aorta is elastic, because whenever the blood comes, what happens is these guys stretch out. Now let's make this was they can stretch out, right? They can stretch out, and then start squeezing the blood, okay? Start squeezing the blood. That's what these guys do. So whenever they receive all this blood, the volume of the blood stretch out, and then it started squeezing and sending to the systemic part of our body, right? Then what happens? And now this time these guys are open, right? So your atria, the left atrium, and your aorta, they're working as just a one system, because they're just working at the one system, because the valve is your aortic valve is open right now. Because of that, all the blood, whatever blood is here on your left ventricle, it is going onto the aorta. Okay, that's what is happening. Now then, slowly what happens is that when it squeeze it, and then what happens is that the ventricle, the volume of the blood started decreasing here. Okay, so it cannot generate that much pressure. So what happens is that the pressure started falling down here from there. Okay, and still when the pressure is falling down, what happens is that still some of the blood is left over, still going up. That's what it is. Actually. So when that happens, we call it still. We call them because the pressure is falling down, but still throwing some of the blood out. Okay, so that's why we call this as phase as slow ejection phase. Okay, but this is slow ventricular ejection phase. Okay, this is slow ventricular. Even this one is a rapid ventricular, and this is also slow ventricular ejection phase that's happening, right? Now, what happens is that now blood is started falling down. Same thing here is going from here on the right side of the heart. What happens is this is open right now, okay? This valve is open. So from here, there's 11 millimeter mercury to 25 millimeters mercury. It's going in. Even here, the pressure is 25. This is just the average I'm giving. And when it started falling down, what happens? This is also started falling down. Now, when the pressure becomes around like let's say 100, 104 and all that stuff, because aorta is what, because aorta started squeezing, right? When the aorta starts squeezing, what happens? Some of the blood start trying to go back into it, okay, from the aorta to the ventricles, okay? So let's come back to it. So some of the blood from here, what happens is that from this side, let me draw the red. From the aorta, let's say some of the blood try to go back into it, okay? When the blood aorta from here, it try to go back into it, what happens? This valve, it pushes the valve, right? It pushes the valve, and then the valve it pushes the valve because the aorta is coming down and pushes the valve, and then valve will close. Okay, because remember they have core tendon and all that, right? And they'll permanently close this. Okay, and when they close it, what happens is that your pulmonary valve, your aortic valve, when they close it, it's coming. The aortic comes like that, right? And then basically what happens is that when it kind of makes something like this. So it comes down and then close the valve and come down as that. This is called, they also call this a dichrotic notch. By closing of your aortic valve, it produces sort of like a notch, which is called dichrotic notch. Okay, you should remember that. Or incisura or something like that too, called dichrotic notch. All right, now you have what is happening here. Even this one too, in the pulmonary valve, when try to come back and around like maybe 15 millimeters of mercury, what happens is this valve closes, okay? And when it closes, remember, when something closes, what happens is that some of the blood will still leave and then some of the blood will be out there, okay? So because of that, whatever blood left is here, we call them as that, what is this called? End-systolic volume down here, okay? End-systolic volume. And then this closing of this aortic valve or pulmonary valve, this is where it produces another sound, another heart sound, which is called S2 sound. Okay, this is where your S2 sound is produced. Okay, but what phase is this? Because remember, this is slow ejection phase, right? And as soon as if you turn the left side of the heart, like about 100, 104 of pressure, what happens is the aortic valve closes, and when the aortic valve closes, it produces sound, right? And now the ventricle is going to do what? Ventricle is going to go through a process called relaxation phase, right? And those phases we call them as volumetric relaxation. That is what is going to happen in this phase now. Okay, what is happening into the aorta in this phase? What happens to the aorta in this phase? Aorta is working as just receiving blood, right? They're just receiving blood, same from the venous blood. That's what they're having. The aorta, mitral valve is closed here. Tricuspid valve, which on the right side of the heart, is closed here, okay? So right now, they are working as your relaxation. The atrial diastole is still happening here, okay? Atrial diastole, they're just receiving the blood from the venous blood and just accumulating on the atrium, okay? Even here too, atria is still working as a diastole, they're receiving the blood here, okay? And then even right now, this phase is what? Atria is also relaxed, okay, and also ventricle is also going through the process of now isovolumetric relaxation. The volume of the blood this atria, both the ventricles are also going to relax now in this force. But you have atrial diastole and you have ventricle diastole here. Okay, isn't that cool? So whenever you have atrial relaxations and ventricular relaxation, we call them as a joint diastole. Okay, we call them as a joint diastole. Now what's going to happen here? This is very important concept you have to remember, right? So now what happens? In the isovolumetric relaxation, you have, if you talk about the right side of the heart, you have a tricuspid valve that is closed, so as your pulmonary valve is closed. If you talk on the left side of the heart, you have aortic valve that is closed, and your mitral valve is also closed, okay? That's what is happening here. Now what is happening here? and your atria is receiving the blood. Okay, atria is. So what happens is that as soon as the pressure on the atria becomes a little more, okay, it becomes heavy, okay, the atria feels that, okay. Whenever they feel that, what happens is that whenever they feel the blood and the pressure heavy, as the nodal fires, and this, because of the pressure load, what happens is that this tricuspid valve opens up, okay, and then this one is mitral valve right here. So what happens is that if you're talking about my left side of the heart, like your mitral valve opens up because the pressure happened, and then tricuspid, what is this? Tricuspid valve opens up. So the blood is going to come to the ventricle, because remember, there's some blood left over here, which is called, remember what this is called, at the end of the ventricular contractions, we have some blood left, right? That is called my end systolic volume, right? Usually about like 60 ml blood is left or 70 ml, depends on the person's heart, and then if the person is athletic or not, but usually about that, right? And then, so whenever the pressure becomes high on the both side of the heart, this valve, if you're talking the right, tricuspid valve opens up, and then if you're talking the left, the mitral valve opens up. And whatever the blood that has been accumulating all this in that atrial diastole phase, right, is going to rapidly comes and splash right here, okay? And whenever that rapidly comes, we call them a rapid, okay? It's passive because, look, they're not using energy, right? It's not active. They're not using any, contraction requires ATP, right? And they're not using energy, the ATM is, because of that we call them a rapid passive ventricular filling. Okay, that's what it has. That's why we call them a rapid passive ventricular filling. And then what is, so that's all the blood come in the rapid passive ventricular filling. So this phase we call them as rapid passive ventricular filling, guys. Okay, one of the concepts here you have to remember is like sometimes if you are young, okay, if you're age less than 35 years old, what happens is that or if you're pregnant woman, okay, sometimes what happens is that there could be a one sound produced, which is called S3 sound, okay. Same thing here too. This is ancestral and the rapid, because when the blood comes splashed, right, the splashed of the blood that me able to produce S3 sound, and usually in the young children or pregnant women or people who are athletic, but usually that happens with the younger people, like probably from people who are age 35 and less. But if it's people who are older than that, let's say 35 to up or 40 to up, and if you hear the S3 sound, then usually that is considered as pathological, okay? That's of this phase. Now, another thing, what is happening here is, the last thing, obviously, sorry, I'm going to use the black color to make this hard. You have this right heart, right? And then, so basically, let's say this is my pulmonary trunk, and then this is going to be my atria. Right? Now, look now, guys, so what is happening here? Let me just use the green for this one. So now, remember, we have a field of this is going to ancestral volumes, a rapid passive ventricular filling is there too. This is also rapid passive ventricular filling, and their ancestral volume, right? Now, the last phase is something called, we call them a diastasis. Maybe, I don't know how to spell this, but it's slow passive ventricular filling. What does this mean? This basically what it means is that whatever the venous blood is coming from, like lungs, let's say this is lungs, right? So whatever venous blood is coming, whatever is coming from here, it directly is dumping down here. It's literally dumping in your right ventricle. So this atrium is just working as like a pipe, just like a pipe, just working. So it's just directly coming and slowing, draining the blood into it. Okay, because of that, we call them a slow passive ventricular phase, because even with that term too, what happens is that you don't have, the atria is not contracting. Because of that, we call the slow passive ventricular filling, because it's just directly coming from here, and then from whatever the blood is coming here, so it's directly draining into the draining your right ventricle if you're talking about the right side of the heart, and if you're left side of the heart, the venous blood is directly draining into your left ventricle. And remember, at that time, what is happening here? Your valve is closed here. This valve, which is a pulmonary valve, and the aortic valve is also closed there, but only valve opens is your mitral valve opens. If you're talking left side of the heart, and if you're talking the right side of the heart, you're talking about tricuspid valve is open here, okay? And obviously then after that, then you obviously, what is going to happen? This is the next phase of here. What is this phase? Now, after that, whole this is called end diastolic volume, we call them, because this is at the end where the ventricle has to contract into and the pump the blood out, right? Now, what is the next phase? We go back to the atrial contractions, right? We go back to the now. After this, what happens? The SN will fire and the atrial contract, and this cycles will repeat. Now, if you're, and usually how long does it take to have this process? Usually what happens is, like, if you divide, like if you do 60 seconds, right, divided by, if your heart rate is 72 per minute, then usually get 0.8 seconds. That's usually normal. And look at this graph, guys. If you look at this, which phase is longer? If you look at the atrial contraction, look, atrial, let me write it down in the red for this one, right? Guys, and I also draw different this, guys. So if you look at the atrial systole, right, usually it takes about like 0.1 second for that one, or you can simply say 100 milliseconds for this one, right? And then if you talk about the isovolumetric contraction, look, isovolumetric contraction here, this phase, and rapid ejection phase, and then a slow ejection phase. These all are your systole. These are your ventricle systole, okay? So usually that takes like 0.1, 0.1, 0.1. So that would be 0.3 seconds. And what is happening in the atria right now? Atria is relaxing. Atria is going through process and here, this isovolumetric relaxation, rapid passive ventricular filling, and this slow passive ventricular. What is this? 1. So if you look at this, 1, 2, 3, and what is this? Atria is contracting, but ventricle is relaxing. So that gives us about 0.4 seconds, right? So 0.4 seconds, right? So you have all together. So if you add all of them together, right, usually what does it take? About 0.4 plus 3, usually it should take about 0.8 seconds, right? 0.8 seconds. And this is 0.8 cycle is a cardiac cycle per beat. That's what this means. Now, if you look at it, which one is longer? Atrial diastole. Where is atrial diastole is happening? This is the only atrial contraction, right? So all this was 1, 2, 3, 4, 5, 6, right? All of them is your atrial diastole. So atrial diastole is longer. Okay. What about joint diastole? Joint diastole I also talked about. Joint diastole basically means that both your ventricle and your atria is relaxing. So whenever, look, in isovolumetric relaxation, this is where your, what is it, ventricle relaxing. This is also both aorta, and this is also your slow diastole. And this is a time where your both ventricle and your aorta is, both atriums and ventricles are relaxing. So usually, like if you add all the ventricular diastole, so ventricular diastole should be about, if you add all the 0, 1, 2, 3, 4, so it should be 1, 2, so there's only 3 phases, right? So you should have 0.5 seconds. That would be your ventricular diastole, and then 0.3 seconds would be your ventricular systole. So that should give you about 0.8 seconds per beat. Okay, so this is the whole cardiac cycle that I just drew. One of the things that I also wanted to talk about, okay, I talked about S1, S2, and S2, one more thing that I also want to mention is that, whenever S2 contracts, we said dub. Like if that sound is, where is S2? Here, dub. Okay, so that's what we said, lub dub sound. That's a dub sound that it can produce. And then one more sound, which is S4 sound right here. S4 sound usually are pathological, but in younger children. If you're 40 years old and young, and if this sound is produced, then we usually consider that as pathological. But sometimes people who are aged about 40 years old, if the sound S4 is produced, it may not always have to be pathological. So that's a something concept that you have to know. And because the main sound that produce is your S1 sound and S2 sound, and these are very important sound because this provides a framework for other hard sounds. and also for the murmurs, murmurs which can be timed. So these are very, very main your heart sound, S1 and S2 sounds, okay? And remember, the S1 is best heard if you're talking about S1 is best heard, if you're talking about the left side of the heart, it's best heard on your mid clavicular, on the fifth intercostal space. And then if you're talking about the right heart, your S1 is best produced on your fourth intercostal space because of the tricuspid valve, right?